Thank you very much, Speaker. I have received an impassioned letter from a critical care nurse at our local hospital in Oshawa. She writes, quote, "I have been watching the tsunami of COVID cases in this third wave with great trepidation. The Ontario government has said they didn't know it would be this bad. They needed to see the effects in the hospital before finally acting. Too little, too late. There's absolutely no accountability on their part for ignoring the provincial modelling presented by science and health experts in creating this crisis in our healthcare system. I am devastated by the rising COVID cases in our community and our province due to the government's poor communication and negligent mishandling of this pandemic. Their ongoing refusal to protect Ontarians with paid sick days and their callous cuts resulting in an inefficient public health system that can properly test, trace and isolate are abject failures of leadership. Their vaccine rollout has demonstrated systemic inequities in marginalized communities and is abhorrent. Their lack of accountability for their decisions and their actions is unforgivable. Critical care units here in Durham Region have moved several critically ill Durham Region residents to centres in Kingston and Ottawa to try to ensure critical care services are available here for the many COVID and non-COVID patients requiring our services. Emergency measures to redeploy non-ICU staff have been issued to help us manage this third wave. I have been a registered nurse for 34 years and a proud critical care nurse for 25 of those years. I am gutted by what this Ontario government has allowed to happen to our healthcare system. They must be held accountable for choosing ideology over science, for listening to business and lobbyists over health experts. Thank you." End quote. Thank you, Speaker, and thank you to our frontline services.